The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're happy to have you all here with us this morning. My name is Sunny Lawless, and I'm the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'll be your host this morning, and presenting for us today will be Keith Havens, our Media Outreach Specialist, and Justin Grimble, who is our Vermont Community Outreach Specialist. And today, for the January installment of Webinar Wednesdays, you're going to get to know your local Senior Medicare Patrol. During the presentation, you're welcome to type in any questions you might have into the chat, but we're going to hold those until the end of the presentation when we open things up for Q&A. Before we get started, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. So who is Senior Medicare Patrol? Well, before we get started on that, we do have a quick polling question for you. Today's polling question is, before today, have you ever attended an SMP presentation? So I'm going to go ahead and launch the poll. Yes or no, if you wouldn't mind going ahead and putting in your answers. Have you ever attended an SMP presentation? And I'll give everyone just a few moments to lock in an answer. All right, just a few more seconds. All right, I'm going to go ahead and close the poll. It looks like, let's see, about 56% of you have attended one, where 44% have not. So it's kind of almost split down the middle. So good. Thank you for answering the poll. And there we go. So before I pass it over to Keith, I do want to give you some background information on SMP. Senior Medicare Patrols are grant-funded projects of the federal U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, the SMP programs are sponsored by AdviseWell. And the mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And now I'll turn things over to Keith, who is going to share more information on what the Senior Medicare Patrol does.
Okay, thank you, Sunny. And I just want to welcome everybody who's joining us today. We appreciate you taking the time to join us for our webinar. So what is it that SMPs do? And basically our work is in three main areas. First, what we do is we conduct outreach and education. SMPs give presentations to groups, we exhibit at community events, and we work one-on-one with Medicare beneficiaries. We provide education opportunities for seniors at places like senior centers and independent living facilities. We also are available to speak to church groups and other small groups. Our presentations typically last anywhere between 15 to 20 minutes, and then we allow some time afterwards for Q&A. We provide educational materials and giveaways to the attendees. We could also schedule virtual presentations for groups. Now, the second area is we receive beneficiary complaints. When Medicare beneficiaries, caregivers, and family members bring their complaints to the SMP, then SMP makes a determination about whether or not fraud, errors, or abuse is suspected. Now, when fraud or abuse is suspected, we make referrals to the appropriate state and federal agencies for further investigation. And the third area is that we engage volunteers. Protecting older persons' health, finances, and medical identity while saving precious Medicare dollars is a cause that attracts civic-minded Americans. Our volunteers receive training to give presentations on Medicare fraud and scams, and they attend community events to help spread awareness of the SMP program, and they also participate in monthly webinars and other activities. So this will give you an idea of our team members in the different states. And you can see in Georgia, we have Nathan, who is our team lead for Georgia and as a community outreach specialist. We have Brenda, Shay, and Jose, who are all community outreach specialists in Georgia. And our team in Louisiana, we have Sandra Coburn, who is a community outreach specialist, and we have Yolanda Moody, who also is a community outreach specialist. And then Mississippi, we have Danae, who is a community outreach specialist. We have Danielle, who is the team lead for Mississippi, and she's a community outreach specialist on the Gulf Coast area. And our newest employee is Brandy, who's a community outreach specialist in the the Delta area and North Mississippi is what she covers. And then in Vermont, we have Jean, who is our community outreach specialist, and Justin, who you will hear from in a few more minutes. And of course, our program would not be successful without the dedication of our supportive volunteers. And this is some data on the results for 2024. You can look at those and see that this is the SMP program overall, and that this is there is an SMP program in every state and in the territories such as Puerto Rico and Guam. So Medicare loses anywhere between $60 and $90 billion every year due to fraud, errors, and abuse. And that is billions with a B. And some experts even think that it's more than that. But you can see that it's a lot of money is being lost every year. And that's why it's so important for people to beneficiaries to get involved in trying to prevent fraud and errors. So how can you tell the difference between what is fraud and what is abuse? So the main difference between Medicare fraud and abuse is intent. Was the improper behavior intentional and conducted knowingly? Now, only the authorities will be able to make a final determination, not the SMPs. It is still important to know the differences in the definition of fraud and abuse. Both terms are commonly used. The actions authorities will take depend on whether they suspect abuse or whether they suspect fraud. Fraud assumes criminal intent. Medicare fraud is defined as knowingly and willfully executing or attempting to execute a scheme or ploy to defraud the Medicare program or obtaining information by means of false pretenses, deception, or misrepresentation in order to receive inappropriate payments from the Medicare program. The Centers for Medicare and Medicaid Services further defines fraud as the intentional deception or misrepresentation that the individual knows to be false and does not believe to be true, and that is made knowing that the deception could result in some unauthorized benefit to himself or herself or some other person. Medicare abuse involves payment for items or services when there is no legal entitlement to that payment and the provider has not knowingly and intentionally misrepresented the facts to obtain payment. Medicare abuse is further defined as incidents or practices by providers that are inconsistent with accepted sound medical, business, or fiscal practices. These practices may directly or indirectly result in unnecessary costs to the program, improper payment, or payment for services that fail to meet professionally recognized standards of care or that are medically unnecessary. CMS includes in the definition billing Medicare for services that are not covered or are not correctly coded. Okay, now that you know the differences between fraud and abuse, let's take a look at some of the common examples of Medicare fraud. Billing for services or supplies that were not provided. Providing unsolicited supplies to beneficiaries. Misrepresenting a diagnosis, a beneficiary's identity, the service provider, or other facts to justify payment. Prescribing or providing excessive or unnecessary tests and services. Other examples include offering or receiving kickbacks in exchange for using your Medicare number, requesting Medicare numbers at an educational presentation or in an unsolicited phone call. So how could all of this affect Medicare beneficiaries? Well, obviously, there's medical identity theft. Medical identity theft occurs when a beneficiary's Medicare number is misused, either by a provider, a supplier, or by someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised. A beneficiary whose number is compromised may be affected forever by false claims against his or her Medicare number. And there's also a health impact. Receiving health care from a fraudulent provider can mean the quality of the care is poor. The intervention is not medically necessary, or worse, the intervention is actually harmful. A beneficiary may later receive improper medical treatment from legitimate providers as a result of inaccurate medical records that contain false diagnoses, records showing treatments that never occurred, misinformation about allergies, or incorrect lab results. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed medical benefits. For example, some services have limits. If Medicare thinks such services were already provided, they will deny payment. And also, of course, there's personal financial losses. Medicare fraud, errors, and abuse can all result in higher out-of-pocket costs for beneficiaries, such as co-payments for healthcare services that were never provided, were excessive, or were medically unnecessary. Beneficiaries may also find themselves stuck with bills for services from providers who should have billed Medicare, but instead billed the beneficiary for the entire cost of that service. Okay, now I will turn things over to Justin, who will share the 3 keys to success in preventing fraud, errors, and abuse.
How's it going, everyone? Thank you so much, Keith. I appreciate it. Thanks for doing such a great job. All right, the first step is prevent. You got to treat your Medicare and Social Security numbers like your debit or credit card. Do not carry it with you unless you need it. Do not provide your Medicare number to individuals that are not authorized medical professionals. Remember, Medicare will not call to ask you about your Medicare number. The next important thing is to detect. Keep track of your visits to the doctor, clinic, hospital, or pharmacy and compare them to your MSNs or your EOBs. Review your information for potential errors, fraud, or abuse. This includes, but is not limited to, double billing, charges for services not received and or not ordered from your doctor. Report. It's important to report the suspected fraud, errors, and abuse. If you suspect that you are at risk or maybe a victim of Medicare fraud, report it immediately. Contact your SMP for assistance with Medicare scams, waste, or abuse. Reporting any possible errors or fraud helps to save your benefits and protects others from becoming a victim. In addition to reporting fraud using our toll-free hotline number, you can report fraud on our website, www.stopmedicarefraud.org, by clicking on the orange Report Fraud button on the screen below. And then fourth, we'll go into now what happens when you report that fraud. When you call our toll-free hotline number, we will collect information from you about the suspected fraud you believe is occurring. After reviewing the complaint and appropriate documentation, if any, SMP will determine whether fraud, errors, or abuse is suspected. If an error is suspected with the provider, SMP will attempt to work with that provider on getting that issue resolved. If we are unable to resolve the issue with the provider and fraud or abuse is suspected, SMP will refer the complaint to the appropriate state and federal agencies for investigation. When you call SMP to report fraud, please be prepared. You will have to provide your address. In some cases, depending on the issue, it might be necessary for you to provide your date of birth and your Medicare number. It would also be helpful if you have copies of your Medicare summary notices or explanation of benefits and any bills that you receive from your provider on hand that are related to your complaint. Next. Now, another thing you can do that can really help out is volunteer. You could help by giving presentations like the one you're hearing today, or just by attending health fairs in your community to distribute SMP materials. Please call our toll-free number, 877-272-8720. That number is on everything we use. You can speak with a volunteer coordinator and receive more information for volunteering on our program. And you can follow us on Facebook and other social media platforms that can help you stay up to date on the latest scams and whatever events that we're doing presentations or attending. You can also keep informed by going to more of these webinars. It goes over all of our top fraud talks and can be very helpful. Together we can fight fraud. Remember, it's important to call up SMP to report potential healthcare fraud and discuss related concerns. Call SMP to request presentation or to let us know about an event in your area. Visit our website for more information about the SMP program in your state. stopmedicarefraud.org.
All
Next,
right.
please.
Thank you, Justin and Keith, for that information on our program, teaching everyone what Senior Medicare Patrol is and how we can help them maybe in the future. Coming up next month for Webinar Wednesdays, as Justin mentioned, we do have a different topic for each month. And in February, we're going to be talking about how you can use your Medicare summary notice or your explanation of benefits to fight Medicare fraud. And that presentation is scheduled for Wednesday, February 25th at the same time, 10:30 Central, 11:30 Eastern. So be on the lookout for the invitation to join us then. And now it is time for our prize drawing. So everyone who is registered to attend today's webinar prior to 10:15 has been entered for a chance to win. And you do have to be present here to win. And the winner is going to receive their a $25 Amazon e-gift card. So if you'll give me just a moment, let me pull up the prize wheel for everyone. Let's see. All right. And then let me just make sure I can see the list of names so I can see who is here. Let's see. Why don't we do something real quick? Everybody, if you're here and you're ready for the prize drawing, raise your hand for us. Let us know that you're here and ready to see if you are our winner. You should have a little hand button over in your little go-to control panel, and you just click on the hand and it'll raise it. I see one hand, a few hands. Good, good. Thank you for just letting us know you're still here and you're ready to see if you're the winner. All right, so let's go ahead and give this a spin. Let's see if Ava Garcia is here, and she is. So congratulations, Ava. I will be reaching out to you after the webinar wraps up to make sure I have the correct information so we can get you that gift card. So congratulations, Miss Ava. All right, let's get back to our webinar slides. There we go. All right, so now it's time for question and answer. So if you have a question that you'd like to ask about the SMP program, now's the time. I'm going to lower everyone's hands now, but if you want and you have a question, you can raise your hand or you can type it into the questions panel. We did have a few questions and comments come through, so let's see. Someone said, I understand that fraud means deceiving someone on purpose to gain money, services, or benefits unfairly or illegally. Another person commented that some Medicare fraud I have experienced is when I was overcharged for Medicare treatments than what the normal pay would be. Let's see. Another one. What happens to a beneficiary's coverage or benefits if their Medicare number is used in a fraud case? So in the very rare circumstances that someone uses your Medicare number to commit fraud, depending on the circumstances, Medicare may elect to issue you a new Medicare number. So you start over with a brand new number. Sometimes your number might be flagged as being compromised, like we mentioned earlier in the webinar, to where they just kind of maybe pay a little closer attention to the claims that are coming through, but it won't affect your coverage or benefits. That all should be the same. It's just a matter of them paying attention more closely to your Medicare number when those claims do come in. And we got a few comments about thank you for the lecture. So we thank you. We appreciate you all joining us today. I think that's about all of the questions that we have, and I'm not seeing any other things coming in. So we do want to thank you for joining us this morning for Webinar Wednesdays with SMP. Thank you to Keith and Justin for sharing that information with us this morning. And just keep in mind, you know, our toll-free hotline number and the email, the website, stopmedicarefraud.org, if you have any other questions or concerns. I will send an email after today just thanking you all for joining. So if you have any questions or concerns, feel free to reply to that email. And everyone take care and enjoy the rest of your week. And we hope to see you again next time.